Welcome back to The Birds and the Bees with your friend Eve, where we tell you all the things about sex your parents were too embarrassed to say. Today, we're going to try to destigmatize and clarify something that's often demonized in our culture, the herpes virus. I'm joined with two guests who are going to tell us more.
Thanks, Eve. I'm Chad.
And I'm Rebecca.
We're here to give a little more background on this sexually transmitted disease. There are over 80 kinds of herpes, but only about 8 infect human beings. The two major viruses are herpes simplex virus 1 and herpes simplex virus 2. Both can infect the genitals, the mouth, and even the eyes.
Any area of the skin can be infected if there's a way for the virus to enter. Herpes can be passed through sexually or non-sexual contact. That's part of the reason why over 50% of Americans test positive for HSV1.
Wow.
Yeah, I've heard that 1 out of 6 Americans has genital herpes. Plenty of people you meet every day are living with herpes. What are some of the symptoms that people might have that are associated with this infection, Rebecca?
Some symptoms of genital herpes include itching, pain around genitals, flu-like symptoms, and burning when one pees.
In fact, the most common symptom of oral herpes is the appearance of cold sores. If you've ever experienced a cold sore, then it's likely you have oral herpes.
That's fascinating. Plenty of people have cold sores. Why don't you tell me a little bit about the treatment methods for herpes?
Well, Eve, there are 3 main treatment methods for recurrent genital herpes. Episodic treatments can be either provider or patient-initiated and involve addressing symptoms at the earliest sign of onset. For patient-initiated treatment to be effective, however, patients must be taught how to determine whether they are experiencing symptoms and what to look for. Should symptoms present continuously, patients can participate in suppressive treatment, which, while the most effective treatment method, can be quite costly for the individual.
When the eyes are infected, it's called herpes stromal keratitis. It can cause clouding of the cornea and needs to be treated by a medical professional immediately. There is no cure for herpes, but there are plenty of treatments and plenty of people live full and happy lives after diagnosis.
Wow, thanks to Chad and Rebecca for all that information. As a closing statement, remember there's no shame in getting tested. Join us next week when we cover the ins and outs of anal sex.